Neglected tropical diseases are a diverse group of disease conditions mostly affecting poor and neglected communities living in tropical and subtropical areas. Globally, more than 1 billion people are affected by the devastating health, social, and economic consequences of these diseases. In Nepal, NTDs such as leprosy, lymphatic filariasis, kala azar, dengue, rabies, and snakebite envenoming continue to remain public health problems, disproportionately affecting the most marginalized populations. In addition to significant morbidity and mortality, those who suffer from NTDs also face stigma and discrimination, resulting in limited economic opportunities. NTDs cause a vicious cycle wherein conditions of poverty perpetuate these diseases while the health impact of these diseases perpetuates poverty. But ending NTDs is possible if we unite and act together. Nepal has made great strides against neglected tropical diseases through decades-long control and prevention activities. In 2012, the country eliminated leprosy as a public health problem at the national level. In 2018, the country eliminated trachoma. The number of reported new cases of kala azar has declined by 86% in the last 2 decades. Out of the 64 endemic districts for lymphatic filariasis, 49 have already stopped mass drug administration. Likewise, access to snakebite treatment services has expanded throughout the country with the establishment of 88 snakebite treatment centers, and free anti-rabies vaccines are now available at the primary healthcare level. While significant progress has been made in the control and elimination of NTDs in the country, there is a vital need to consolidate these gains to further reduce the burden of disease and to move closer to achieving Nepal's control and elimination goals for NTDs. Developing focused strategies to reach the unreached, strengthening cross-border collaboration, fostering engagement with non-health and the private sector, and strengthening health systems against NTDs are some of the key measures that must be adopted. Similarly, we cannot ignore the impact of shifting global climate patterns on NTDs. I am pleased to note that Nepal is currently developing national roadmaps and strategies for NTDs such as kala azar, lymphatic filariasis, and rabies based on WHO's global roadmap and WHO's regional strategic framework. This is an important step towards embracing an integrated approach to fighting NTDs and an acknowledgement of the fact that ending neglected tropical diseases is not possible without a whole of society approach. Lastly, on World Neglected Tropical Diseases Day, I urge everybody, including leaders and communities, to unite and act to address the inequalities that drive NTDs. Let us all do our part to ensure NTDs do not remain neglected anymore.